Yeah, this is in my book, but I'm going to kind of be elaborating on what's in there. And I think it's really helpful to understand the red flags and green flags, partly because any one particular one may be negotiable, but the more red flags you have lining up, the more of a problem you have. And same with the green flags. The more green flags you have, the more appropriate the person is. So really seeing everything I'm about to say as a scale. And the more of one or the other they have, the more appropriate or inappropriate they are for psychedelic work. So let's go down the list. So this is the list of red flags first. So the first one is age. They should not be underage. They should be legally and emotionally an adult. Now, it's curious because in Indigenous communities, often younger people were included in Indigenous ceremonies, and I completely understand that. But then being protective of psychedelic therapy today in the context of North America, we need to be working with adults. That was number one. Number two is having an unstable life. And that can include housing, but you don't want a lot of stresses on you that are kind of resolvable stresses. If you're going through a huge conflict or dealing with challenges at work that are really big and transient, and really don't have anything to do with one's sort of personality and one's unconscious mind. It's just, I'm really in a tough place right now because I have to deal with this issue. They're probably not appropriate for psychedelics, partly because the housing issue will dominate and they won't really be able to get into their actual issues of their life. Pregnancy or breastfeeding is another one. Now, it's curious because all of the evidence actually says that there isn't any harm from psychedelics with women who are either pregnant or breastfeeding. But that isn't the issue. If a woman is either breastfeeding or pregnant and takes a psychedelic and then has a problem with her child later, she may blame herself. Why did I take that psychedelic? It probably has nothing to do with it, but it just is something that you probably don't want to combine those two. So pregnancy and breastfeeding are exclusionary criteria. There are a list of medical conditions, and I won't go through a lot of them, but certainly cardiovascular disease, untreated hypertension are kind of the two main ones. There are other ones, but you need to have a sort of a medical workup and just see if it's appropriate. Any disabling, unstable, or acute mental illness. Now, there are subtleties within that, but certainly people that have depression have been shown to be helped by psychedelics. But you start with a psychiatric assessment and you look at what you have and you exclude based on which diagnoses pop up. And the borderline diagnoses being the primary ones that you probably want to exclude. Addiction-related issues are another red flag. Now, they often come down to what will the withdrawal be like if somebody has stopped taking alcohol. If they're physically addicted to alcohol and then they take a psychedelic and just stop abruptly, they're going to go into withdrawal. And so how do their addiction-related issues interact with a psychedelic if they're taking a lot of sedative drugs, for example? That can be a problem in this context. So understanding what other drugs people are taking and either understanding the main effect or the withdrawal effect will be problematic if they have to deal with it in either the psychedelic space or afterwards. Absolutely, yeah. If you're on an SSRI, you will have a reduced impact. And so it's very, very hard to dose people. So there are really two issues there. One is getting the dosage right. The other issue, so the dosing issue is one, but having multiple medications on board is the other. So how do they manage this? If they want to treat their depression, there are side effects of the antidepressant medications that they're on. And so having to deal with the side effects as they're coming off as part of their integration process for the psychedelic is really challenging. And having gone through the withdrawal period, so you're not actively dealing with withdrawal in the integration process is really helpful. Another issue, another red flag, is just the history of trauma. So just being understanding what it is. And, if somebody's coming to you with PTSD and they want MDMA work, yes, I think MDMA is the perfect medicine to be working with trauma with. but understanding it, understanding the trauma, understanding how it manifests in the person's life, understanding how it can come out during psychedelic experiences, understanding that the body elements of trauma and the disassociation that can come with trauma, fight, flight, and freeze being 3 of the trauma responses. So just if you're going to treat somebody with PTSD or with trauma, then really you need to understand it, and you need to understand how it's going to manifest and how the healing pattern looks. Having high anxiety or panic attacks is helpful to understand, and how you're going to manage that should that manifest during the psychedelic experience. So doing some screening for that is important. Poor or little emotional regulation. How do you, questions like, how do you handle your feelings? What kind of feelings do you experience? Can you tell me the last time you experienced a real challenge where you were very upset or angry or sad or distressed? And how did you manage that? How did you regulate your emotion around that? Do they have emotional regulation techniques? They know that long, slow, deep breaths are helpful when they're feeling anxious. So understanding how they regulate and can they regulate their emotions. Chronic stress responses, sometimes that are physical, are useful to check for. What's going on in your body? Oh, my back hurts a lot. Oh, what's that all about? Was it some specific injury, or was it a manifestation of some life event, some unconscious process? Neurological disorders, stroke, epilepsy, serious brain injury, probably are ones to avoid. You don't want to be inducing a seizure in somebody. So just being very cautious around neurological issues. We talked about serotonin and managing people who take any kind of serotonergic medication. The SSRIs, the MAOIs, St. John's wort is an over-the-counter supplement that people can take. It's a herb, and sometimes people take it to manage depression, and it can also be a problem. So you have to ask about what people's supplements that they're taking are. And there's many. If somebody lists off many mental health medications, lithium, valproic acid, haloperidol, risperidone are all examples. If they just have a long list of the ones that they're on, it's useful to be cautious at that stage. People who are suicidal, or quite frankly, homicidal, are useful to screen for and probably best not served with psychedelics. Maybe wait until those issues subside. People with anger management problems, ask them about their history with how they managed anger. When they get angry, everybody gets angry. How do they manage it? And do they have ways of calming themselves down? It's also useful to check not just their own personal psychiatric or mental health history, but their parents or first-degree relatives, siblings and parents. Now, they're not exclusionary, but just be aware of it and really be thoughtful around what people have. And usually you want to check for both personality disorders, psychotic issues, and bipolar issues. Having mania on board when you're in a psychedelic space can be incredibly difficult to manage. Mm-hmm. Another issue to check is, are they in couples conflict? What is their relationship like at home? If it's conflictual, it is not unreasonable that they will have the insight during the psychedelic experience that they need to leave their partner. And if they leave their partner, the partner may be very angry, and they may be angry with the therapist. And so just being aware of that is really helpful. One of the kind of fundamental scales that I have in my own brain is the scale of responsibility versus blame. How do I fundamentally see my life? Am I responsible for my actions in the world, or do I blame others? I was not responsible for what I did because of this. Fill in the blank. So is the individual taking a lot of responsibility for what they do and their feelings and their actions and what's going on for them, or do they blame everybody and everything? That scale is crucial. Psychedelics tend to work a lot better with people who take responsibility for their lives, and they work a lot worse for people who are blaming. Another one is sort of what I would call about attachment to the story. This is who I am. This is my story. This is what happened to me, and I'm going to fix it. And there's a real kind of rigidity in how the story is presented. And the idea that they might be open to retelling the story, for those who are interested in that branch of therapy, which is the rewriting of one's story, and retelling one's story to oneself is a useful way of thinking about this. But rigidity around story is a red flag. The issue of transference, negative transference, is crucial to understand because it will happen during a psychedelic space. So how the person sees you as the therapist and sees other people in the helping profession, and understanding that everybody does it. Everybody does transference to everybody else. We're always projecting our stuff on the world around us and the people around us all the time. So knowing that we do that, are people able to take responsibility for doing that and understanding it? Because that will be intensified during psychedelic space significantly. People who are essentially alone, little or no support network, is a pretty significant red flag because they need support. What's your friendship circle like? What are your relationship with your family like? What are your work relationships like? So that question is crucial. And the more alone people are, the less likely psychedelics are going to be able to help them. People with a strong support network are better candidates. Having people in their lives who don't know about or are unsupportive of the psychedelic experience. If you go and have an intense life-changing experience and you go home to a partner who is either surprised because they didn't know you're doing it, or mocks you for your change in behavior, that's a problem. So having supportive people around you is important. In fact, there's set, setting, and matrix as the three levels or the three attributes that will change the experience. You need to manage how you're thinking about the experience, what the experience is like, and what happens when you go home. Essentially, do they take responsibility for their own mental health? Is there some language in there about, this is really difficult for me, and I know that I can deal with it, and I know that I can get on with this, and there must be some lessons in this experience for me? Is a very different kind of languaging than, I've been depressed forever, I can't get rid of it, I'm trapped, it's not my fault, what's wrong with my brain, please fix me. Those are two very different languages around what could be the same situation. Desperation, you are my last hope. Desperate people tend to not do well in psychedelic therapy. And often that comes down to borderline personality disorders, which I've talked about. The expectation that it will fix them is a crucial issue. There's a slide out there that many of us use that has images of the connections in people's brains. And the brain connections are increased dramatically under the psychedelic experience. Now, the more that image gets floated around, the more people believe that taking a psychedelic is about taking your car into a garage. And that's actually a factor in people not doing well. The more people believe that the psychedelic alone will fix them and they don't need to do all the hard work at the end, the integration work, then the less likely they're able to do. In fact, it's interesting, there was some recent research that was coming out about the fact that there seems to be more adverse events happening in the world of depression research. And there was a discussion around why that is. And one of the beliefs of one of the researchers was because the expectations are higher. And if people walk in because there's so much media attention to psychedelics and depression, what happens is people really believe it's going to work. And that belief that it will fix them and they don't have to do the work actually makes things worse. So tracking that particular issue is helpful. Wanting to rush into the psychedelic experience. I need to book it now. I need it now, quick, 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 quick. And I don't need to do the preparation work because I'm ready. That's actually a warning sign as well. Somebody who keeps phoning you back in advance with more and more questions and concerns, and the questions and concerns don't really make sense. You've already answered that question. And so somebody who's frequently contacting you with more strange questions, that's a concern. Needing to drive the process. I am the one that's damaged. I'm the one that's going to fix it. I would just need the drug to help me, give me the drug, and I'm going to be okay. I'm the one in the driver's seat, as opposed to the willingness to just relax and learn the lesson that needs to come. And I don't exactly know what the lesson is going to be. Controlling behavior, rigid mindset is not helpful. Always focusing on seeking validation from others. So an unwillingness or an inability just to kind of go reflect internally. If I'm looking for you to tell me who I am, that's a red flag, as opposed to I know who I am and I can talk about that. That's the red flags. Let's talk about the green flags. So, and again, with the red flags, it isn't any one particular one that is crucial. It's all the constellation of them. So the more red flags somebody has, the more inappropriate they are. And the more green flags they have, the more appropriate they are. So let's go through the list of green flags. So if they have experience in therapy, in groups, in counseling, or even in coaching, where they've kind of been open to the process of working on their issues, that's a green flag. They're on their journey of self-discovery. And by that, I mean, they can actually talk about their issues fairly deeply. Their ability to self-disclose, because they've been part of this process for a while, they have an ability to reflect and self-disclose and talk about their issues openly fairly early on in the process. Expressing a deep desire to do the work and to do the deep work, like I'm willing to go to this place. And having a more exploratory approach as opposed to a fix-it approach. A fix-it approach is a red flag. An exploratory approach is a green flag. Having a regular meditation, breath work, or yoga practice, just having been involved with sort of healing practices generally is a good thing. Being open-minded, I'm open to seeing what the medicine has to teach me is a really good introductory comment. Having a spiritual practice, and being not just involved with spiritual beliefs, but having a practice that you actually do. Having the ability to surrender and let go and just be there with the experience is a crucial green flag. Already having had positive psychedelic experiences is helpful, but you also don't want to have somebody having too many. If somebody's done MDMA 50 times, they probably have a permanent life inability to experience the beneficial effects of MDMA. So there is a point, and it varies quite widely with different people, when specifically with the empathogens, when they stop working. The classic psychedelics keep working, but the empathogens, you have a lifetime number, you can take them and then you're done. It just has it doesn't have a therapeutic effect anymore. Good question. I know it's true with MDMA. I have a good understanding it's true for MDA, and I'm not sure with 3-MMC. I don't know. Actually, that one I don't know about. I'm not sure. Already had positive psychedelic experiences, but not too many. Generally a positive regard, believing that it's helpful, ready to heal, kind of this will be a useful tool for me, I believe, is different from this will fix me. Trusting in the therapist is important, trusting in the process and being kind of open to that trust. Is prepared, they're willing to do the work to prepare themselves for it, and ready to do the integration work afterwards. So prepared in the beginning and ready for integration. the more specific somebody's expectations is, the less useful it can be. But just being open, I don't exactly know where this was going to take me. Show me what I need to know in order to heal. You may have a specific diagnosis. You may be miserably depressed and have that for a long time, but what the healing looks like is unclear. I'm just open to what this needs to show me so that I can manage this issue in my life. Is very different from I'm going to fix this depression. Generally, not having a lot of pharmaceutical drugs on board, prescription drug use should be low. The issue of boundaries is crucial. So how people understand and work with boundaries, so and closeness and non-sexual touch. And so being able to talk about boundaries, being able to talk about what non-sexual touch is about, especially for anybody that has that in their practice. So an easy understanding and ability to discuss boundaries and touch is crucial. If somebody gets really, really upset, even having that conversation, then you need to talk about why they're concerned about that conversation, because it has to be really, really clear. You have to have very, very clear non-negotiable agreements that happen in advance. Having a good support network is a big green flag. Close friends, partner, family, close work relationship, colleagues. A good support network is very, very helpful. And appreciate. And if the therapist has other complementary do things like body work, that understand that and they can work those. And the more somebody has, the more helpful will be in their life.